All indoor activities in San Diego have been ordered to halt amid a recent uptick in coronavirus cases. Joining us this morning to talk about the latest rollback plan and the COVID-19 numbers is trauma and emergency physician Dr. Kelly Victory. Dr. Victory, welcome to KUSI. With a name like that, you should be a high school football coach, you realize.
Good morning, Paul. Thanks for inviting me.
Could you just quickly paint the broad strokes of your resume so folks understand that you come to this from a scientific and expertise background?
I do. Thank you. I am a trauma and emergency physician, as you said, and I spent many years as a hospital-based trauma specialist. For the past 2 decades, I've really been more in the public health arena, advising and working with large companies, Fortune 100 companies, as well as hospitals and school system and municipalities as they work to develop disaster preparedness and response plans for everything from hurricanes, earthquakes, active shooter scenes, and pandemics. So I have a lot of experience doing that. I actually was working with Continental Airlines during the SARS epidemic back in 2003, so got some experience in how to manage that, deciding how to keep their business going, who to keep home, what to shut down, and those sorts of things.
So you know of what you speak. So let's deal with the rising number of COVID-19 positive test results. It has spooked a lot of people across the fruited plain. You say.
Well, here's the situation. And to be clear to your viewers, this virus is very real. I have never claimed or would never claim that it's a hoax or anything of that sort. The issue is we know who the people are who are at high risk, and that's very good. We know those risk categories: people over the age of 65, people with significant underlying health conditions, primarily things like diabetes, heart disease, obesity, underlying lung conditions. So the problem with just looking at numbers, at case numbers, is it doesn't give you any indication of really how it's impacting people or the healthcare system. The vast majority of people who become ill with COVID-19, fortunately, are not ill. They have no symptoms at all. Upwards of 80% of people, in fact, who get the virus are not likely to become sick with it. So simply focusing, and unfortunately, the public has no choice because the mainstream media is beating people over the head, not only on a daily, but an hourly basis with, here's the new case report. We have an uptick over here. We've seen a spike over there. So people have focused, I believe, on the wrong thing, which is case numbers, rather than looking at hospitalizations and, more importantly, deaths.
Well, you bring up hospitalizations because I've been following the numbers here in San Diego County as closely as I can via the dashboard, and we're up maybe 150 hospitalizations from where we were a couple months ago. It's a grain of sand when you consider our population. Am I misreading that? Because that seems to be the reason for a lot of drastic political decisions.
No, I think you are precisely right, Paul, and that's happening not just in San Diego, but across the country. We are seeing some upticks in, quote, hospitalizations, but it's important for people to understand that those hospitalizations aren't necessarily even COVID-19 patients. There's a very real entity that is impacting us that I call COVID lateral damage, and it's all of the people who for months did not go to get medical care for things like diabetes and heart disease and cancer, who are now flooding into the hospitals far sicker than they otherwise would have been. We're seeing people who had a heart attack 2 weeks ago and saying, why didn't you come in at the time? And they're saying, because I was afraid or because I didn't want to get exposed. So a significant part, I would submit to you, of the uptick in hospitalizations is actually not from patients who have COVID-19, but people who delayed care. Furthermore, we've now stopped the moratorium on surgeries. So there was a big backlog of people who were scheduled for elective surgeries who are now coming in. But anyway you cut it, we have to look at whether or not a hospital is being stressed to the max, having trouble meeting capacity. And we really aren't seeing that, and certainly not in San Diego County yet.
Well, what we are seeing is the decision here in San Diego County and in Los Angeles to not have in-person schools come fall. We just had Cindy Martin, our unified superintendent here, say the reason the decision was made is because it's simply not safe for the kids to go back. She cited numbers saying our numbers are as bad as they were in March. Is that true?
I believe that the decision to keep schools closed or activities for children is an epic mistake. And here's why. First of all, we know that children are at an extraordinarily low risk for becoming ill from COVID-19, almost a risk of almost zero. The children across the country who have become ill and have needed hospitalization have almost to a person had significant underlying health conditions. Furthermore, we know that children are unlikely to be a vector, meaning a spreader, if you will, of COVID-19. They carry far less virus within their noses and throats, what we call viral load, even if they do get the virus. They carry about 25% of what an adult will, so they aren't likely to spread it. So for both of those reasons, I think it is a real mistake to keep schools closed. It has profound impact, not only on the economy, on parents who have to stay home and therefore can't go to work, but on the social and psychological development of children. And one of our mandates in public health, unfortunately, is that we have to consider the impact of any of these decisions on the overall health of the population, not just on a single individual. That's the difference between practicing primary care medicine and public health. We need to look at what is the impact of any decision and weigh that, balance that, the good for an individual against how it impacts the entire population, and not just their health, but their economic health, their social health, psychological health. Those sorts of things have to be taken into consideration when you make massive decisions and mandates and start shutting down the entire system.
I think Dr. Spock said it, the needs of the many outweigh the needs of the few or the one.
Right. Unfortunately, and that's tragic. Not that we don't mourn the loss of people who become ill or need hospitalization or God forbid, die from this disease. But when I hear someone in the public health space say, if we can only save one life, well, unfortunately, that is not the mandate of public health. We have to consider the impact of these decisions on the entire population and weigh that. And fortunately, we know the at-risk population, and we can easily rally around those people. Fortunately, the vast majority of them aren't actually even in the working population right now. They are older people, and we can easily work around and protect that group without shutting down the entire economy, I believe, and certainly without impacting children in the way that we have.
Last question, Dr. Kelly. How come your argument doesn't gain traction on a grander scale? Why do you feel like your voice is unheard?
Well, unfortunately, it's a great question, Paul. Unfortunately, this has become the most highly politicized issue that I've ever experienced in my lifetime. And that's a tragedy, because this isn't political. I have no political agenda. I'm reporting the science as I see it, as I know it, and based on my experience. But it has become such a political football that people, if you say anything about opening up the economy or anything about the fact that masks really aren't indicated for people who are healthy, or that there's no such thing as quarantining the well, you are tarred as sitting in a particular political camp. And that's really a shame, because it doesn't do anyone any good. I would implore people to stick to the science, look at the facts, look at the trends. Stop paying attention to day-to-day, minute-to-minute numbers of an uptick over here or a hospitalization over there. Look at the trends. Otherwise, it's like driving a boat. If you keep trying to correct every minute-to-minute, all you do is zigzag across the water. You can't make a straight line anywhere.
Dr. Kelly Victory, thank you for debuting on KUSI. We look forward to speaking with you again.
Happy to be back anytime.
All right, still ahead.